Pilgrims didn't land at Plymouth Rock with a Blue Cross card in their wallet. That was the thought of it. And they did, you know, where did the idea come from that if I get sick, somebody's going to pay the bills? Well, I got on the internet, did a little research. Anybody know where it came from? Give me your best. I'm not trying to embarrass you, because I'm telling you, 4 or 5 years ago, I didn't know the answer to this question. Where did healthcare come from? Anybody? I've heard people say, well, it was the labor movement. Yeah, that's how it grew. Sorry?
World War II.
World War II. It did explode on the scene after, but it actually went back further. See, that I had the same thoughts, but what I found has been the ultimate wake-up call. Let me tell you what happened. At the start of the last century, healthcare was the exclusive province of the rich. If you were Rockefeller and got sick, you could go buy healthcare. Now, Glaxo and Pfizer hadn't invented any of those great drugs in those days. It was pretty crude. It was like bloodletting and leeches. But if you were sick and had money, you'd go get health care. Remember, antibiotics didn't come along until after World War II, largely. The Great Depression changed all that. Even the people who had previously had money were broke. Nobody could afford health care anymore. And one day out in Texas, 3 hospitals got together, Baylor and 2 others got together and had a meeting. And Baylor had just hired a new CEO. They were all going broke. And the new CEO had had a previous job as the superintendent of the Austin school system. And when he looked at who all couldn't pay their bills, he was shocked to find most of them were school teachers. And he thought, God, I know a lot of people are out of work and hurting in this economy, but these are people with jobs, and they can't afford to pay health care anymore. So they decided they had to fix it. They hooked up with an actuary from Texas state government. Anybody know who or what actuaries are? Run for your life. That's the end of it.
Scary people.
Remember, the actuaries are the ultimate number geeks. It's kind of like the old story about the guy who applies for a job as an actuary, and the guy doing the interview says, how much is 2 + 2? And the guy says, how much do you want it to be? I love this one. You know how to spot an extroverted actuary? He stares at your shoes when he's talking to you. Actuaries, they're just number geeks. That's all right. Look at him laugh. You've had a few conversations with those people. They're very important in the universe. But those people in Texas hooked up with an actuary, and he said, well, wait, it's not as bad as it looks. Based on the populations in the communities where U3 hospitals are located in Texas, if people gave you 25 cents a week, you could keep the doors open. Now, I'm a student of human nature, too. I love knowing what people are going to do based on certain stimuli. And I know how the conversation in that room went was 25 cents a week's a lot of money in hard times. And what will we give them? The food's awful. Well, somebody decided, how about if they ever get sick, we'll take care of them. Blue Cross was born in that room that day. Now, didn't mean Blue Cross. I got in trouble telling this story once, and some Blue Cross lady thought